Assalamu alaikum. Hi, I'm Dr. Akbar Ali, working at Al Noor Polyclinic, Rashidia. Today, I would like to discuss about newborn care. So, first we should know whether baby is a term baby. When you call it's a term baby, it should be more than 38 weeks. And the birth weight of the baby. So, when you call it's a normal birth weight, it's more than 2.5 kilogram. What are the care you're supposed to give? Breastfeed the baby. When to breastfeed? Immediately after birth. Even for Caesar, half an hour after section we have to breastfeed. Give a warmth. So how we will give a warmth? Better warmth care, it's a kangaroo technique. Keeping the baby skin, baby and mother and attached together. It's give a good warmth. And covering the baby with a warm towel. And skin care. What is the skin care? Bathing the baby. So how often we have to bathe? If it is a normal 2.5 kilo, you can regularly give a bathing. What are the soaps? They ask, what are the soaps to be asked? It should contain more fatty acids. Why to avoid dry skin lesions. Better use more fatty acid contained fats. Shampoo should not be used for the head if it is required. The routine vaccine, as per the schedule, you have to follow your doctor and give the vaccine. What is exclusive breastfeeding? Give a feeding continuously for 6 months. Then after 6 months, starting a weaning. It's a giving supplementary food to the baby. So usually I recommend to give a homemade preparation. That is best preparation and easily digestible. To avoid undue incidents like a respiratory tract infection, loose motions. So these kind can be avoided by giving a homemade preparation or the mother feeding. Apart from that, we have a vitamin D insufficiency in our place. So better you can give the vitamin D supplementation to the baby up to the 1 year. The recommended dose. Erythema toxicum. The rashes, as soon as baby is born, on second day, third day, there will be rashes all over the body, which appears on third day, which disappear on 6th or 7th day. It's a normal. It doesn't need a doctor consultation. Number 2, melia. There will be white patches on the face near the nose. It doesn't warn you to take you to the doctor or hospital. That also normal. You see some baby, after feed, they will regurgitate the feed. It's a normal. If you do proper burping, after feeding, each baby has to be given burp. If you give proper burping, the regurgitation and abdominal colic will come down. So regurgitation of feed, it's a normal. But the vomiting after every feed, it indicates you have to take the baby to the doctor. Regurgitation is normal, don't worry. And abdomen colic. Why it's abdomen colic? Evening time, most of the babies, they cry. While crying, if you see, they'll fold their leg and cry. It's abdomen colic. It's a normal for the newborn baby. Even doesn't need any treatment or consultation with the doctor. If we proper burping after feed, that also will reduces. And we see sneezing most of the time, newborn baby. It's a normal. It doesn't need a doctor. But coughing, it's an important. You have to take to the doctor. Usually if baby is taking adequate feed, you have to monitor the output of the urine. Usually in newborn period, the baby must feed more than 6 times a day. Yeah, nasal block. Nasal block, it's a normal for a newborn. Due to the developmental, the airway is narrowed. That's why when narrowed airway, when baby breathes, you get that sound. It's a normal. Doesn't need any consultation. If you are worried, you can give a normal saline, 1 drops each nostril 3 to 4 times. This will be alright. Doesn't need much medications. Most of the patient and parents worried about a passing stool or not passing stools. Passing stools for more than 5 to 6 times, it's a normal. Don't need to worry at all. And some baby will not pass stool for 4 to 5 days. That's also normal. Don't worry. But we have to worry when? If baby pass stools with the blood, you have to worry. If baby doesn't pass stool, you have to worry with the vomiting and distended abdomen. It indicates there is some obstruction. Otherwise, whenever baby is taking normal feed, activity is normal, voiding urine normal, it indicates baby is well baby. No need to worry. I told you about the condition which doesn't want you to take to the doctor. But the same time, you must know the condition which required to take your baby to the doctor. Number 1, fever. So fever, it's a very danger. You always alarm. When there is a fever, you have to take a baby to the doctor. And number 2, feed. If not taking proper feed, when baby is not well, it will not take a proper feed. If not taking proper feed, you have to take the baby to the doctor. Number 3, irritable cry. Sometimes the baby will cry. After counseling, the baby will be alright. But this will not stop. The continuous cry will be there. If indicates you have to take the baby to the doctor. And output of the urine, because if baby takes a normal feed, the urine output is going to be normal. If decreased urine output indicates it's need a doctor consultation because feed has decreased. Vomiting is the most important. Whenever the baby continuously vomit, each after feed, you have to take the baby. But regurgitation is different, vomiting is different. So regurgitation after digestion of the milk, that is called regurgitation. The milk comes immediately after what you feed, that is called vomiting. So then you have to take the baby to the doctor. And blood in stool, that is most important. Another thing, a cough. Whenever the baby cough, it indicates some lower respiratory and fast breathing. If it's breathe faster than a normal, with the retraction, you can see the abdomen will go down while breathing. Then they'll breathe fast. Then they'll cough. It indicates something, a lower respiratory. You have to take the baby to the doctor. Hi parents. Thanks for patient listening. Hope we'll all have healthy child, wealthy world. Thank you.